Well, good afternoon and welcome to Wednesday Wellness, a free live educational series presented by Trinity Health. We are thrilled to have everyone here with us this afternoon as we dive into this important topic. Before we get started, we do have a few housekeeping notes. We have turned off your camera and microphones to ensure a smooth experience. And if you have any questions during this presentation, we just ask that you use that chat feature, which is located near the bottom of your screen. We can address questions at the end of the presentation. And then lastly, we are recording today's presentation, and a link to that video will be shared with you via email in the next couple of days. And without further ado, I am pleased to introduce Dr. Kelly Holder from our Trinity Health Lax Cancer Center.
Hello, everyone. I'm just going to do a quick sound check. If I can get a thumbs up or something, just so you know I'm all good to go.
I think you are good to go.
Yay! I'm so pleased to be here and have this opportunity to meet with all of you today. Today, we're talking about mental health and wellness during cancer care. So I'm Kelly Holder. I am a clinical psychologist. I've specialized in work in healthcare populations and working with healthcare providers. And I'm currently the director of oncology, mental health, and wellness. And today we are going to spend some time talking about some of the work we do within what we call psycho-oncology. I'm going to also give you some resources and some tools you can use. Today, we're also going to do some things that are experiential. So I hope that you're in a comfortable place so that you can participate with me as well. And so let's just do it. We're going to get started. Let's see. So I want to let you know that this is, can you all see? Yeah, this is a safe space and a safe zone. We're going to be talking about some things that might get a little bit of uncomfortable. So number one, I want you to be judgment-free of yourself. If things come up as we talk about mental health and challenges, we all have some challenges in our emotional and mental health care. And so just trust yourself as we go through this time together, and hopefully you'll take away some things that you can use. Please step away anytime. Your comfort comes first, and then know that there is going to be some resources and tools that you can use throughout this presentation. So I hope that it will feel like time well spent together today. So why does mental health matter specifically within cancer care? The research is clear. We know that 1 in 3 individuals who suffer from a chronic health condition has some sort of mental health challenge or some sort of mental health struggle. If you find yourself in this bucket, you are not alone. You are in good company, and it's at this point part of our humanity, part of our human experience. We know that cancer impacts every aspect of someone's life, mind, body, and spirit. We know about the body clearly because, folks engage in their oncology care with their care physicians, but there's also emotional and mental and psychological changes that happen as well. Our emotions are impacted, and so are the relationships that we have with the people around us because of the changes that may be happening in our body, some of the treatments that are involved. This impacts all of our lives. And so there's research that lets us know that depression rates are 3 times higher in those who are experiencing cancer and living with cancer than the general population. And so this is just important to know because there are some things that come with treatment and having a diagnosis of cancer that can just heighten some of these emotional and relational concerns. And so we want to address them. So what I want to share with you right now is how this came to be. This here is a picture of Dr. Jimmy Holland. She is known as the founder of psycho-oncology. She was the chair of the first ever psychiatric service that was embedded within a cancer center. And this was done at MD Anderson. And so the work that she has done has changed and impacted the way that we care for individuals with cancer. Before her, there wasn't anyone looking at some of these emotional changes and looking at them in the ways they impact cancer patients. And so, because of the work that she's done and many others following her, we've learned so much more about how we can care for individuals, how we can support them. One thing that was most interest to her was how do people cope during these situations? Um, Not only was she interested in cancer, but she came into this because of her interest in individuals living with chronic illness. And so, because of her work and her passion, we began to understand these things. And psycho-oncology is typically now embedded within cancer care, within cancer centers everywhere. And this is a gift to us because of the work of Dr. Jimmy Holland. So, what does the research show around some of these things? First, we know that when individuals get psychological support, it reduces loneliness, it can help reduce depression, and it can aid with some of the emotional distress and challenges that come along with diagnosis, not just diagnosis, but the treatments involved. We also know that support improves outcomes. It improves quality of daily life. It improves treatment adherence rates, people being able to stick to the treatments that are done, and it improves overall well-being outcomes. There's all kinds of treatment that are really helpful. There's been a lot of research done on cognitive behavior therapies and all the therapies that fit within that bucket. And so there is evidence that these particularly find strong benefits for cancer patients. So the research is clear that this kind of support and this kind of treatment is good. And I find it a privilege that I have the opportunity to do this work here at Trinity Health. So this is a reflective question. You don't put it in the chat, but I'm wondering what you've experienced. Have you ever had any of these experiences around stress, maybe some anxiety, feeling anxious about something? Maybe you've experienced low mood or depressive like symptoms. What about uncertainty or fears about the future? What about fatigue, just not being able to get going? Maybe you've experienced all of these. Maybe you're someone who has a cancer diagnosis and had these things increase due to that. Maybe you're a caregiver and you've seen how these things can increase because of the care that you provide. Maybe you're a healthcare provider or someone who works within the medical profession and have seen increases in these around different times of your caregiving and supporting others. I'll raise my hand and say that I have experienced all of these things. And so, what we're going to do for the next few moments is I'm going to give you some ideas about the support tools that you can use to addressing some of the common experiences around these things. And then we're also going to do a little experiment together just to aid you in understanding what some of the support systems and treatments can look like when you're having these experiences. Again, this is part of our humanity. Many of us have had these experiences, and you can imagine how having a diagnosis of cancer and supporting someone with it, also all the treatments and challenges involved, can increase these experiences as well. So we're going to start with stress. Now, stress gets a bad rap, but we know that there are aspects of stress that are important to us. Just the idea that we have to get up and get going can sometimes be a stress or a stressor. Oftentimes, when we're talking about stress, especially in this context, we're talking about the stress that leans towards chronic stress and the stress that makes life more difficult. We know that stress impacts everyone differently, and it is a normal response to the things that are happening around us. Stress is a signal that our bodies are trying to protect us. And so, if you feel stress and you feel your stress increase, know that this does not mean that you're weak. It does not mean that there's something wrong with you. It means that there is something important happening that you are paying attention to, and that you might need more resources to help support whatever that challenge may be. All right. So your response makes complete sense. What are some of the things that we can do to help manage stress, especially when we're living with cancer, a new diagnosis, or supporting someone? One of the things is having some comforting routines. We can't control everything in our lives, but there are some things that we can have control over. And those routines can be helpful, whether it's a quiet start to the morning or a warm tea or coffee ritual. Maybe it's a ritual that's at the end of the day to unwind. Maybe it's the time that you have a regular conversation with someone you love or you care about. Maybe it's just the comfort of knowing that at these certain times is when I have my meals or when I gently move my body. Whatever routines are important to you, holding on them can create safety and stability during a time where it feels like everything is shifting or changing. Restorative rest can be helpful. We know sometimes with treatment, rest can be disrupted and sleep might not be what it was before. But even outside of that, you can create moments, quiet moments of rest during the day or in the evening, just as a comfort measure for managing stress. Gentle movement is really important. We know short walks, exercise, stretching can help release tension. One of my favorites is practicing some mindful moments, taking time to pause, to breathe, to pray, to notice the present or the moment in front of us can also give us a time to pause and slow down, which is helpful for managing stress. It's really important to hold on to meaningful connections to family or friends. Anyone who brings joy and life to your life, you want to maintain those connections. And you might want to reach out and say, hey, maybe we schedule a regular routine of checking in or talking with each other. Another helpful tool is just practicing self compassion, being able to see yourself just as valuable as the people you care for, or the people that you think about in your own life. Again, these are very short and manageable tools, but all things that we can do to support ourselves. All right. Now I'm going to ask you to participate with me. We are going to do a chair stretch. And below here, I have the instructions, and I'm going to do it too. And again, there's all kinds of different easy stretches that we can do to bring some goodness and some calm to our bodies. And so this is just a quick stretch. So I'd like you to participate with me by putting your feet on the floor and sitting on the edge of your chair. And then to begin this, it's best to kind of fully move your arms straight above your head and then move into the twisting motion. So I'm going to move to my right. And I'll put my arm on the back of my chair, my right arm on the back of my chair, and my left arm at the bottom of my chair. And just do this twist. Now, I'm sitting in a twisty chair, so I can move so you can see what I look like here. All right? And just get that stretch in. I can feel it in my shoulder and my back. Again, just move as gently as you can. Don't push. You shouldn't feel any tension or you shouldn't hurt, all right? Stop if you feel any hurting or anything like that, all right? And so now I'll just twist myself back around. I'm going to put my arms back out, and then I'm going to gently twist in the other direction again. And I'll move my chair. You can see. I'm twisting. All right. Ah, the tip here is to inhale and lengthen your spine. And then just gaze over your shoulder. And you can hold that. Yeah. Then just bring yourself back center and relax. I wonder how that felt for anyone. If you want to go in the chat and put a thumbs up if you thought, oh, that was an easy stretch and something helpful. Let's see. Let's see if anyone puts anything in the chat. Just a thumbs up if you gave it a try and if it was helpful. There's all sorts of websites. This is from everydayhealth.com. Quick stretches for stress relief and things you can do right now. And you can use that website, and they have several other stretches from some poses to gently stretching your shoulders and other things. Again, it's a simple technique, but something that can be really helpful for reducing stress and bringing some calm into our bodies. Right. So now we're going to switch our attention and talk about depression a little bit. So it's important to be able to recognize the signs of depression. Some of the signs include persistent sadness or emptiness, maybe feeling loss of interest in activities. There can be changes in your sleep or your appetite, particularly within cancer treatment and care. This one can be hard sometimes because some of those changes may be due to treatments or medications, but it's worth paying attention and noting any changes that you're having physically or with your medications or treatments that could be impacting your sleep or your appetite, but still worth paying attention to. Feelings of guilt or worthlessness, these sense of feeling like you're a burden, that other people have to care for you, and then maybe some difficulty with concentrating or making decisions. Again, this was an important one to pay attention to because with some treatments and things, there could be some cognitive changes. So you always want to share these things with your healthcare providers, with your medical team. Please know that if you have these symptoms and experiencing them, it is not a sign of personal failure. As we shared before, these symptoms are common within cancer populations. And so if you're a caregiver and you're experiencing these, don't see it as a personal failing as well. These are things that can happen. So what are some of the things that you can do? One, I want you to talk to your care team about it, all right? Make sure you're mentioning this to your primary care doctor. You also want to mention this to your oncology team, all of those who provide you treatment. We also have within Trinity Health social work oncology teams that support. And so if you're meeting with social work or have those appointments, you can even reach out for those appointments to share these experiences that you're having. This is another place where you can share this information. Spiritual care and chaplains can also help. And then also palliative care providers who might be part of your team. You want to share this information. Know that help is available and that therapy, talk therapy, things that I can do as a psychologist can provide relief, but medication can also be helpful as well. And so allow yourself to have all the discussions to see what might be right for you, given the symptoms you're having and given all that's going on with your life. It's important that you know crisis support resources. So the 988 Suicide Lifeline is always available to you, as well as 911, which is a general emergency number. So with that said, what are some of the things that you can do for yourself? What are some of the gifts you can give yourself if you're noticing that you're having some depressive symptoms? Again, gentle activity can be really helpful. There is something about moving our bodies that can be supportive. And so small movements count. It doesn't have to be, if we're big into exercise and don't have the capacity to do that again, it doesn't have to be that. Even the stretching can be helpful. Again, you can talk to your medical team about that. Nourishing food, making sure that you are fueling your body as best you can. If you need to work with nutrition or a nutritionist, these are things that you can mention to your care team and find out additional support for that as well. Again, you do not want to neglect connection and being connected with people who matter to you. Again, being in community is one of the best gifts that we can give ourselves. So as we build those relationships, we want to hold on to them and have that support for dealing with whatever emotional changes we're having. Another thing that you can do that's very simple is noticing small joys. Notice the things in your life that brings light. And it can be as simple as when the sun comes out or enjoying the snow. Maybe it is a fun interaction with someone you love or someone in your family. Maybe it's a food you enjoy. Maybe it's a smell you enjoy. Maybe it is something funny that you get to watch. Again, keep track of these small joys because each little one matters and it can make a difference in your life. When depression is on board, sometimes these things get harder to recognize. And so don't see it as a personal failing if it's harder to recognize during this season, but you can ask for support around these things. Other things that can be helpful are journaling, just writing your thoughts and ideas on paper. And we cannot neglect spiritual supports. What are the things that bring meaning to your life? The things that bring you peace? How do you dial into those things and support yourself, again, in gentle ways when you're noticing that you're having some depressive symptoms? And these, again, are gifts you can give yourself. We don't want to neglect reaching out to your care team and talking about the symptoms and telling folks what's going on. These are things in addition to asking for support and care. Again, especially if you're noticing suicidal thoughts and things like that, you want to tell your care team right away, and you want to use those emergency resources. 988 is a great resource to call and have that conversation and saying, I'm having these kinds of thoughts. How can I get some support? Because folks want to support you, and we're here to support you throughout this journey. So this next activity is, I would like each of us to take a moment just to notice some joy. And so we're going to use the chat feature, and I would like for you to put in the chat maybe one joy that you've noticed. You can do that. You can even, if you don't feel like typing out something, you can put in an emoji as a representation of a joy that you've noticed today or within the last 24 hours. All right, we're going to give a moment. I'm going to give you a moment, and then I'll share one of my joys with you. Let's see. Okay, so I don't think I can see the regular chat. Maybe I can't.
Dr. Holder, over in the Q&A box, if people drop
Oh,
it in their joy into that box there,
I see it. I see it now. Yeah.
yep, everyone can drop their joy into the Q&A box. That would be fine. And only Dr. Holder will be able to see those notes.
All right, so we'll give it a few more moments now that I know where to find, and you all now know where to put things. I'm sorry, I see in here that the chat was disabled. And if it's okay with you all, I'll just share some of these. People share pets like cats and chickens, Oh, being with their love of their life. Oh, that is a joy. Oh, dogs. Someone has joy with dogs. Very nice. Oh, my children. Yeah. Let's see. More joys. Oh, my garden. Oh, sleeping deer under pine trees this morning. Oh, what a beautiful sight to be able to see those things. Ooh, eating a comfort treat after work. I have a little joy. I like marshmallows, and so I keep a bag of mini marshmallows. And every day I treat myself to like 4 or 5 little marshmallows. It is one of my things I enjoy. Um, Nieces and nephews. Oh, music. Music. Oh, that's a good one. One of my joys is I every year I make a playlist, and this year's playlist focus is on joy. And so I have all these songs that are focused on joy that I listen to at the start of my day. It's like my own soundtrack. Thank you all so much for participating. I mean, just noticing joy, again, it doesn't take away all the other things that are happening. But what it does is it helps widen our perspective and helps us see more of what's happening in the world. Here's a little truth, right? One truth is that because our brains were built for survival, we tend to notice negative things uh, really well. And so our brains process those things in order to keep us safe. And there's research that indicates that in order for us to have, um, in order for us to basically combat this negativity bias that we have standard, that our ability to pay attention to goodness or positive things may need to be 2 to 4 times more often than the hurts, the pains, the negativity that we see, just so that we can have a fuller picture of the world. And so sometimes we get a little like, oh, I don't want to be toxic positive, or, oh, it's too much, because we think, if we're too positive, we're not living in the world in which we are. But what I want to share with you, in order for us to live in the world in which we are and face the things that we're facing, we have to be able to pay attention much more to the good around us. And that will enable us to hold all the things much better, because our negativity bias will keep us from seeing the good. And the positive part of that is that there's research that shows that when we are just highly focused on negative, it impairs decision making, and we know it has a negative impact on our mood and all of those things as well. But with the decision making, we need to be able to make good decisions for ourselves. So these are just some little reasons and nuggets why we want to notice joy, and we want to try to notice it as much as possible so we can just have a better view of our world. Right, let's see how we're doing with time. We're not doing so bad. All right, next we're going to talk about anxiety a little bit. So anxiety shows up a lot and really easily. Some of the common triggers that happen within cancer care are anxiety before appointments, maybe anxiety before tests or scans. In fact, the anxiety that happens before tests or scans is so great, it has its own name. It's scan anxiety, they call it, right? So it happens a lot. Fear recurrence after folks have gone through treatment. Will it come back again? Uncertainty about the future. So the anxiety is all around. Anxiety impacts us physically, right, with some restlessness. And if you've ever experienced anxiety or unknown, we know that we feel it all in our bodies. It impacts us physically. We can have our heart racing, a tight chest, experience tension, and it also impacts our thinking. We have racing thoughts, causes us to have some difficulty focusing. So What can you do for anxiety? There's all sorts of techniques that help. Again, the same things that I shared for depression are really important. Talking to your treatment team, telling them about the symptoms, letting them know you're experiencing anxious symptoms, worry, thoughts, restlessness, inability to control the worry. These are things that you need to share with any and all of your providers. Okay. So some of the things that work that are very helpful is learning some breathing techniques. Those can aid us in having mastery over our bodies and knowing how to get calm. And so we can practice that on a regular basis. Mindful practices, being able to stay in the present. It really helps with uncertainty because with uncertainty, we're always thinking in the future. And while there is time for that and it's important, we can't always be there. And so being in the present can help ground us and help us have a bit more, have less anxiety in the life that we're living. Again, there's a gentle movement. Again, exercise is good for everything. Having calming routines, like we talked about before, journaling can be really good. And then again, trusted providers, making sure you're getting professional guidance and support along your journey. All right, so now we're going to do a focused breathing awareness. I'm going to stop sharing for a moment because I put together a script for you and I am, I'm going to put it up on my screen so I can read it to you. So hopefully you're in a good place to participate and participate as much as you like. And we're getting close to the end of the presentation, so this is a good thing to do right here towards the end. All right. Or are we in the middle? We're at 12:30. All right, so we have a little bit of time. Here we go. So, just looking, make sure we don't have a comment. So I'm going to read this script to you and just engage as much as you choose, as much as you're comfortable doing. All right. So this is a focused breathing awareness exercise. And these exercises are one of my absolute favorites. So I'm privileged to share this with you. All right. So first, let's begin by taking a moment to get comfortable. You may sit back in your chair, place your feet on the floor, and rest your hands wherever they feel at ease. If it's comfortable for you, you may gently close your eyes, or you can soften your gaze and look downward. There's no right or wrong way to do this. Simply meet yourself where you are. Now begin by bringing your attention to your breath. Take a slow, gentle breath in through your nose and release it slowly through your mouth. Do that once more. Inhale softly and exhaling fully, letting go of any tension you may be holding. One more time, breathe in, feeling your lungs gently expand, and breathing out, allowing your body to soften. Now, allow your breathing to return to its natural rhythm. There is nothing you need to change or control. Simply notice. Notice the breath as it enters and as it leaves. Notice where you feel it most, perhaps in your nose or your chest, your belly or your shoulders. Just observe. As you sit here, you may begin to notice other sensations, perhaps the temperature of the room, the feeling of your clothing against your skin, or the support of the chair beneath you. You may notice sounds, scents, or movement around you. All of this is okay. If your mind begins to wander, if you notice thoughts, worries, memories, or plans appearing, gently acknowledge them. And then, with kindness, bring your attention back to your breath. No judgment, no criticism, just returning again and again to this simple rhythm, breathing in, breathing out. In this moment, remember that you are valuable. Whether you are here as a patient, a caregiver, a healthcare worker, or a supporter, your presence matters. Your life matters. Your efforts, your compassion, your courage, they matter. With each breath, with each breath, you are being sustained, moment by moment, breath by breath. This simple act of breathing connects us all. It supports you, it carries you. It reminds you that you're still here, still worthy of care, still deserving of rest, still deserving of peace. Now, allow yourself to rest in this awareness for a few moments. Breathing in, breathing out, knowing that this place of noticing will always be available to you. Anytime, in any setting, in moments of stress, uncertainty, or fatigue, you can return to your breath. You can return to yourself. Now, as we begin to close this time together, start to gently widen your awareness. Notice the room around you. Notice your body in the chair. Notice the sounds nearby. Wiggle your fingers or toes if that feels helpful. And when you are ready, gently lift your gaze or open your eyes as you move forward into the rest of your day. Carry with you any sense of calm, steadiness, or ease that you found in this moment. May this simple practice continue to support you in your work, in your caregiving, in your healing, and in your living. Thank you for taking this time for yourself. All right. I hope that that was as calming for you as it was for me just reading it. I promise you, breathing awareness exercises are one of my favorites just because it doesn't require us to make many changes. It just requires attention. And we can give our breath attention and notice it. And it's simple, and it also gives us some goodness in return. That's why I like it so much. Right. So we'll move on to the next thing that I want to share with you today. And when I started this presentation, I shared that one of the therapies that had been shown, there's been a lot of research done in terms of supporting emotional health, especially treatment with depression and anxiety, and cancer patients, is cognitive behavior therapy. And there's several different kinds of cognitive therapies. And what I want to share with you is CBT in its traditional sense so that you have an idea of what it is, should you want to ask for it, and should you want to learn more about it. Cognitive behavior therapy really is about this connection between our thoughts, our feelings, and our behaviors. And it works to aid us in changing unhelpful thinking patterns that influence how we feel and how we behave. The other thing that works really well with CBT is also learning skills that help us have more mastery over our bodies. So relaxation training, kind of like the activity we just did, or other kinds of things that help us get a sense of control in our bodies. We know that oftentimes when anxiety rises, we feel it in our bodies first and our minds race. And when that happens, it can be really difficult to think and behave in ways that we want to. And so by helping folks get into their body and feel more comfortable, then from there we can start to learn techniques that aid us in dealing with thoughts that could be unhelpful to us. So I wanted to share just an everyday situation that could happen. So, and then apply the CBT technique so you can kind of see how it works. So, someone you care about, you've texted them and they have not replied, right? Some of the thoughts that could come to your mind is, wait a minute, are they upset with me? They usually get back to me quickly. Did I do something wrong? Do they not care about this thing that I sent to them? Am I being ignored? We all have automatic thoughts. They happen automatically without conscious choice. And oftentimes these thoughts come because of things we've been exposed to, things we've heard other people say, things that have been told to us, things that have been reinforced in our lives over and over again. And sometimes those thoughts are less than helpful. Okay. So when we have those thoughts, like the ones on the last slide, how do we feel? Maybe we'll feel anxious or hurt. Maybe we could feel rejected or sad. And some of the behaviors that we'll then do in response is that maybe we'll reread the messages repeatedly or keep checking the phone constantly. Like, why haven't they got back to me? Or maybe send another anxious text. We could withdraw from the connection. Well, if they're not going to reach back out to me, maybe I'm not going to reach back out to them. We'll wait and see what happens, right? Or feel distracted all day because of that situation. So, what CBT can aid us in doing is coming up with better thinking that will help us feel a little bit different and then act a little bit different. And so here are some other things. So the automatic thoughts might come, but there could be some other things that might be true. Maybe they're busy. Maybe their phone died. Maybe they're in an appointment or in a meeting, and they can't get to us right now. Maybe they'll reply later when they have more time or more space to do it. It's not really about just being positive, but it's about having thinking that's more helpful to us so that we feel that we can navigate our emotions much better and we can navigate the situation much better. So again, how could this change things? We could feel a little bit more calm, maybe less tense, maybe we're more patient, maybe we could be more focused during our day. Again, and so this is how CBT works. I gave a simple idea, but this same process we can use to apply to all sorts of things like upcoming appointments and unhelpful thoughts about the appointments that might be coming. Maybe symptoms that you're experiencing. Maybe waiting for news about something. Maybe uncertainty about the future. CBT helps us notice when our minds are making things more heavy for us. And the tools we learn aid us in being able to manage what's coming into our life in a better way, in a way that's a little bit more helpful. So we talked about stress, depression, and anxiety. I gave some helpful tools and tips of gifts you can offer yourself if you're having those experiences. I reminded you of providers and people you can reach out to. You definitely want to talk to your oncology team, but you also want to talk to your primary care docs about these kinds of things if they're coming up. But your support system and your support team matter. And so outside of those providers, you can also have the oncology social workers as part of your team. Maybe you want to engage with the chaplaincy team and have their support. Maybe it might be important for you to join a support group and get information about local support groups and programs in our area. I've gone to Gilda's Club and volunteered there, and that is a great place for connections if you're looking for that kind of support. mental health providers. I am pleased and excited that I have this role within the Lax Cancer Center at Trinity Health. But I'm not the only person who could provide mental health care. Maybe there's a mental health provider you're already working with, sharing this information with them and letting them know that you want to continue care and support and learn tools that can aid you in as you're going through all of these different things with your treatment, or even as a caregiver with supporting your loved one. All right. And also peer support. There is wisdom in shared experience. Each person on here is different and has different needs. And so your support system might look different. You might need one of another, or a different combination. But I am going to encourage you to create the kind of combination that you need, given your personality, given the challenges that you face, and given the needs that you have. Right? I think it's really important. You matter, and this is why all of these services exist. Right. So I just want to gently encourage you around building your own support plan. I want you just to think about, who is it that supports you emotionally, right? Who are those people? Where do you get that? If you don't have it, do you need it? And where could you get it? Is it any of those providers on that list ahead? Maybe it's folks within your own community, maybe your own church or spiritual connections. Maybe it's within your family, but know where you get that support. Who helps you practically? Who can you call up when you need some groceries to be picked up? And that kind of support. Again, aid with daily tasks. How do you get that kind of support? Who do I call when I'm struggling? Who would that be? And what helps me calm down when I feel very activated about all the changes and uncertainty going around? What tools can I use, or gifts that I can give myself to support myself during this season? All right. Um, so hopefully you had a chance to think about that, consider it. And if you haven't thought about it before, take some time and consider answering each of these questions for yourself so that you can build the kind of support that you need. All right. So this is my final slide. Tell you a little bit about the oncology, mental health, and wellness services at Lax Cancer Center. Basically, these services address psychological, behavioral, and emotional challenges that arise for cancer patients and their families. And if you've had any of these experiences, you might benefit from this kind of support. So mood changes or depression, anxiety, maybe there's been a loss of purpose or meaning in your life. Maybe there's been challenges in navigating your care that's created its own set of stress and distress. Maybe there's family and relationship distress that's happening, or stress happening. And maybe there's a lack of social interest. You see yourself withdrawing from the world, and you want to get some support to getting reactivated again. I, again, am a clinical psychologist, and I would be glad to support you in this way. If you are interested in meeting with me, even to learn more or just having a consult appointment, please talk to your provider, your physician, your primary care provider. Maybe you see an APP, an advanced practice provider. Talk with them and ask for a referral so that you can schedule an appointment with me. And I'd be glad to meet with you. Again, these services are here to support you. I give you some evidence of why it exists, and it's had a long history, and I'm really grateful that here at the Lax Cancer Center, we see individuals as whole people and believe their psychosocial health is just as important as all the other pieces of their health, and it will support folks in doing well and living the kind of lives they want to live. So thank you so much for your time. I'm going to stop sharing, and I don't know if there's any questions before we end our time together.
Yes, thank you so much, Dr. Holder. That presentation was wonderful, and we definitely appreciate those exercises that you ran us through. We do have a few questions. So, and just as a reminder, if anyone else has any additional questions and would like to drop them into the Q&A, they can do so, and we will get to those right now. All right. All right, our first question, Dr. Holder, if you don't mind, I'll just read these two, and if you would like to answer them, that would be great. First one is, I find myself trying to comfort my loved ones who are anxious. What can I say to comfort them without taking on their anxiety myself?
Yeah. Oh, that's such a great question. All right. So, number one, I want to thank you for being wanting to care for the folks in your life. Number two, it's important to know that anxiety is kind of insidious. And so when folks are anxious and you tell them just calm down, it backfires. It is can feel extremely unhelpful. And when you're not in the anxiety, you can clearly see, like, okay, it's going to be all right. But when someone is in the anxiety, it's hard for them to see things maybe the ways that you're seeing. And so some of the best ways of support is being able to acknowledge what they're experiencing as real and encouraging them to see if there's things that they could do that might help them in this moment. So, if they're anxious, being able to say, yeah, I understand why you're very upset about that. And while I know I can't convince you not to be anxious in this moment, I'm wondering if there's anything that's helped you in the past that can aid you in feeling more calm in your mind and your body. And can I help you with that? And having that kind of conversation. And it might feel a little bit more collaborative than you just giving all the advice. Maybe they can start to think, oh, okay, maybe there's some things that are within my control to do. So that's my gentle encouragement around that. It can be really hard to support a loved one who's experiencing anxiety.
Thank you so much. Our next question it has a little bit of detail around it. It says, I have high grade aggressive reoccurring cancer. I've told my provider I have been told that enough and want to leave it on the table and focus on moving forward. I'm having trouble not dreading scans and follow-up visits. In my head, I've gone from the original diagnosis to dead. How in the world can I move past this? I'm in the follow-up phase every 3 months. I find CBT is the emotionally draining and takes a lot of work.
Yes. Okay. Yes. Number one, I want to say thank you for taking the time to put all of that in the Q&A and ask this question. Everything you're experiencing is true, and CBT can be a lot. What I would suggest is that um, you take the time to maybe have a consult with a psychologist, another mental health provider, maybe even someone like myself, because there's so many elements to what you just described that the way you experience it as an individual, it will be hard for me to answer that question specifically. But what I will say is that there is help and there is hope. There's a cancer center in Virginia that just put out a study that they did with a treatment regimen that doesn't take forever. That's a psychological treatment that aids with reducing scan anxiety, and they found some really great outcomes from that. And so, if those are things that you want to explore, either with someone like myself or another mental health provider who works within the field of oncology, I would encourage you to do so because there are some other options that could be really helpful to you. And someone just taking the time to sit with you and talk through all of these things may aid you in coming up with a plan that will help you manage it better. You may not get rid of the anxiety completely, but there are some things that you can do so that it does not have to be as anxiety provoking as it is for you right now. So I hope that answer is helpful. It's as truthful an answer as I could give in this moment.
Thank you so much, Dr. Holder. Looks like we have a couple more questions. The next one is, when I'm anxious, I withdraw. What can I do to maintain connections when I don't feel like it?
Oh, man, you guys are asking like all the good questions. Um, when it comes to anxiety and feeling like withdrawing, there are um, the challenge is that there's some things that we do to be self-protective that end up making us feel worse in the long term. And so, because you know that to be true of yourself, in situations where it is safe to continue to engage, you may have to continue to engage while giving yourself gentle encouragement, knowing that I don't feel good about this in this moment, but it is safe for me to engage with these people or this situation or this, whatever it is. And while I still feel anxious, I still am going to engage. In doing that, you start to break some of that reinforcement cycle that you've created, that has been created over time because you withdraw, you feel better, right? And so now you want to make it so that you stay engaged and eventually you'll feel better. Yes, your anxiety is going to increase. And depending on the kind of anxiety you experience and the symptoms that you have, if it's panic or any other symptoms that can feel life threatening, you definitely probably want to consult with a mental health provider to aid you in walking through that so that you can be as safe as possible while you engage and get some tools that can support you in doing that. But that will be the way to break it. And hopefully you'll ask for help if you need it to be able to do to make that shift in the best way possible for yourself.
Thank you. Our next question is, I'm sick of people asking how I'm doing. How can I gently redirect those questions?
Ooh, yeah. So you may you so number one, with your closest people in your life, you may want to go ahead and have that conversation and let them know this that question is less than helpful to me. Let's come up with a plan of how we check in with each other and how I share and how we maintain our connections. You can do that with the people closest to you. With the people who aren't as close to you, but they're asking, and they're asking out of care and concern, you may want to take time to come up with a standard answer that you give and just take your time and figure out what that standard answer will be. Having those kinds of conversations is much harder when it's not someone you want to maintain a relationship with. And so, kind of figuring that part out can be, it takes a little bit just because you might not be interested in maintaining a relationship with those folks. But I would encourage you coming up with a standard answer. But those closest to you, I think it's really important that you have a conversation so that they understand the decision that you come to and how you have decided to stay connected with your family and share information, and so that everyone can be on the same page, and it aids in building those relationships so you receive the support that you need, but also at the same time, your family and the people who care about you can honor your wishes and how you want to be supported during this time.
Thank you so much. All right, this looks like our last question, and it is asking, do you see patients from the other Trinity Health cancer centers?
Do I see? You know, That's a good question. I don't think I have yet. And I don't know what the limits of my capacity are because I just got here. So that's a good question. If there is a way, if you want someone to reach out to you with that information, if there's a way to put some information in the chat and we can figure out a way to get that information to you, because to be honest, I don't know how to answer it.
Dr. Holder, we would be happy to help you find that information and include it in the follow-up email that goes out to everyone.
That would be great. Thank you so much.
Mhm. Well, with that, that concludes all of our questions. So thank you so much, Dr. Holder, for that excellent presentation. And thank you very much for the Q&A as well. And to
Yeah,
everyone that joined us this afternoon, thank you so much for your time as well.
right. It was my pleasure. Have a joy-filled afternoon.